I chose to take the medical elective because there had been residents in my program who had been down here before and had spoken really highly of the program. And we have a lot of Spanish-speaking patients in our hospitals and clinics back home, and I thought it would be really beneficial for me to be able to talk to them and at least learn enough Spanish to get through a normal clinic visit or a normal visit with them without having to call and use an interpreter, both for saving time and also just because it's nice to be able to connect with the patients on a more personal level without having a third person in the room. So that's why I chose to come down here, and I think it's been really great so far for me. So when I moved down here, it was great because the elective had set up all of our accommodations for us. We didn't have to worry about where we were going to be living. I'm staying with a host family that's just a 10-minute walk from the elective center, and they've been very accommodating, super welcoming. They have opened up their house and really just have been great to stay with for the last few weeks. The classes and the teachers have also been really, really great. I think that they do a really good job of helping you start from whatever level of Spanish you're at. So whether you have any previous training in Spanish or not, they can kind of gauge that pretty quickly when you get here and then put you in the right classes so that you're getting the most out of your time. And it's really nice because a lot of the teachers have also done medical school, and so they know a lot of the more common medical phrases that are important for doctors to know. The hospital has also been really interesting to me. I've spent about half of my time there and half in the medical elective, which is what most students do. And it's been really nice to work with different doctors, see how they do things differently here. I've had the opportunity to scrub in on some surgeries, see patients on the wards and labor and delivery, and then also on their gynecologic service and also in the emergency room. So seeing kind of all aspects of how they take care of patients and how they do things the same and differently than how we do at home. So it's been really eye-opening and a good experience. The community health fairs have been very eye-opening for me. I've had the opportunity to go to 2 of them since I've been here, and they're a really great way to get out and practice the Spanish you've been learning in class, but also just to see the different medical illnesses and things that are common amongst people in Peru that we don't always see at home, and how things are similar and different. I think they're also a really great way to kind of give back to the community since we're kind of coming in and joining and helping as we can. I think it's a really good way to come back and just help out where we can in Trujillo. So traveling on the weekends has been really fun. When I got here, the day I got here, the group that was already here had already planned to do some local trips to a couple of the local ruins and then to Conache, which is sandboarding. So it was great. I got here at 9 o'clock and we left that next hour to go on a day trip, which was really fun and nice to just kind of get to know everyone in a more relaxed environment. I've also gotten to go to Juarez and do some trekking, which I know I wouldn't have ever done had I not been in Trujillo for as long as I am. And then I'm also going to get to go to Cusco and Machu Picchu towards the end of my trip. And so it's really nice to get out of the city and even just explore the city more on the weekends with the group and get to know people outside of the hospital and classroom setting. Experience has absolutely lived up to what I was expecting and more. I think I have really improved my Spanish more than I thought I would have and learned a lot more. And the clinical experience has also been great, but I think it's also been really nice to just meet people from really all over the world. We have people from Australia and Great Britain and the US, Canada, and just really meeting people from everywhere and seeing how people do things differently, and it's been a really good experience. I'm glad, very, very glad I came.